Welcome to the educational platform Hub Center, and I am a specialist and expert in cold plasma, Tatyana Bannykh. We present to you two different cold plasma devices. They have the same effects, but the devices are completely different. The first device is PlasmaLux atmospheric cold plasma, and the second device is NeoPlasma, which is argon cold plasma and hot plasma. As is known, there are four states of matter in nature. These are solid, liquid, gaseous, and plasma. Plasma is the fourth state of matter. Plasma is an ionized gas. It is a powerful tool for affecting the skin. Unlike any other traditional methods, cold plasma affects tissues without intense heating. It uses the energy of charged particles and initiates deep regeneration processes. We can achieve a pronounced lifting effect, tissue tightening, deep-level skin remodeling, stimulation of neocollagenesis and dermal renewal, and powerful antibacterial action. Let's first look at the PlasmaLux device. This is atmospheric cold plasma with controlled rehabilitation. An excellent combination of price and results. Makes advanced techniques more accessible. PlasmaLux is not a compromise, but a well-thought-out solution for those who strive to offer their clients effective procedures at a reasonable price without compromising the quality of results. So let's consider the key points of why you should choose the PlasmaLux device. The first is the affordability of the device itself and the training. Next is savings. There are no consumables at all. All attachments are reusable. The versatility of the device. In addition to cold plasma, there is also ozone plasma to enhance the effect. And the depth of impact. Powerful prolonged effects on all layers of the skin, providing a lasting visible result that even the most demanding patients appreciate. Features of working with the PlasmaLux device. During operation, some painful sensations are possible, so the procedure is performed with the use of topical anesthesia to ensure patient comfort. Usually, this is the Korean cream J-Ken. The procedure time for a full face is approximately 2 hours, including time for anesthesia and preparation. There is a recovery period, but it is controlled and predictable. In the periorbital zone, swelling may persist from 1 to 3 days, but it may not occur at all. It is individual. Face and body, hyperemia for several hours, then light physiological peeling for 7 to 10 days. The rehabilitation period is not a side effect. It is a natural stage of skin renewal. At the same time, in the form of plasma, controlled microtraumatization occurs, which also initiates powerful regeneration processes. The cold plasma procedure on the PlasmaLux device is suitable for the same clients. This is a client who is result-oriented, looking for a pronounced effect rather than speed of results, ready to invest time for quality changes, ready for rehabilitation, and understands that a short recovery period is an investment in the result. Can plan the procedure considering their busy schedule. Looking for an alternative, considering an effective replacement for surgical methods or more expensive procedures without losing quality. A client who values the balance of price and quality. This is a disciplined patient who trusts their specialist and is ready to follow recommendations to achieve their goal. Now let's look at the most modern device on the market. This is the NeoPlasma Argon cold plasma device, high-speed argon plasma without pain and rehabilitation, which completely changes the perception of possible plasma technologies. Here we are talking not only about efficiency, but also about maximum comfort, speed, and complete absence of rehabilitation. NeoPlasma is a solution for premium class clinics and patients who value their time and demand impeccable service. What is the superiority of this device? The first and important thing is speed. A full face treatment takes about 30 minutes. And this is speed with a high result of the procedure. Comfort. The procedure is completely painless. In some cases, except for the eye area, anesthesia may be required. No rehabilitation. The client returns to their usual lifestyle immediately after the procedure. No swelling. There may be slight hyperemia, which usually subsides within 30 to 40 minutes. Ideal for people with a busy work schedule. The device operates on medical argon, offering both cold and hot modes, which expands the range of aesthetic tasks in cosmetology and medicine. Let's summarize briefly about the device and consider the important features of the NeoPlasma device. Medical argon is used. This ensures the highest frequency and stability of the plasma arc, which predicts the result. The only consumable is medical argon, but let's consider it a prize for premium class technology that ensures maximum comfort and safety. Work without discomfort and anesthesia, except for the eye area in some cases. The patient is relaxed throughout the procedure. This is very comfortable for both the specialist and the patient. There is no rehabilitation. A huge selection of cold plasma nozzles, 8 for hot and 1 ozone plasma. Expands the range of services in aesthetic cosmetology and medicine. Who is the ideal client for the NeoPlasma device procedure? Well, it's more likely a premium class client. For them, time is the main and valuable resource. Their schedule is planned weeks in advance. Every minute counts. They are not ready for rehabilitation. Even a change in appearance for a day is unacceptable for them. They value the painlessness and speed of the procedure. They appreciate top-level service and are willing to pay for innovations and advanced technologies, choosing based on quality and reputation rather than price. Which device to choose is, of course, up to you. For convenience, I made a comparison table. Let's take a look. PlasmaLux is slightly cheaper, more affordable. NeoPlasma is a bit more expensive. PlasmaLux has no consumables. NeoPlasma uses medical argon. PlasmaLux has slight pain during the procedure and requires anesthesia. NeoPlasma does not. PlasmaLux has rehabilitation with swelling, hyperemia, and peeling for several days. NeoPlasma does not. The procedure time for PlasmaLux is about 2 hours, for NeoPlasma about 30 minutes. The technology in PlasmaLux is atmospheric plasma and ozone plasma. In NeoPlasma, it's argon plasma, hot plasma, and ozone plasma. The client of PlasmaLux is focused on results. The client of NeoPlasma is focused on time, comfort, and results. Both devices are leaders in their segments. PlasmaLux is a powerful, affordable working tool with controlled rehabilitation. NeoPlasma is a solution for premium segment clients where every detail is thought out to the smallest detail. We achieve equally high results on both devices. Indications for the cold plasma procedure are any age-related changes in the skin, tissue, loss of tone, elasticity. Mimic static wrinkles, scars, post-acne, enlarged pores, age spots, uneven tone, eyelid drooping, crow's feet, skin flabbiness, stretch marks. The course of procedures is approximately 3 to 5 sessions, selected individually with an interval of about once a month. Maintenance procedures can and should be done about once or twice a year. It can be combined with other methods to enhance the effect. The result unfolds every day and has a cumulative effect. The duration of the result after the course of procedures lasts up to 2 years. Let me tell you a little about the business model and the payback of the device and training. With an average clinic and specialist workload, the device and training pay off within 1 to 3 months. I can tell you for sure 90% of patients are satisfied and sometimes more, who usually recommend their procedure to acquaintances and friends after the course. After the course, the return rate for maintenance procedures is 40 to 50%. We perform the procedure in the course 3 to 5 times to achieve a more pronounced result. What are the key advantages for the clinic specialist? It's the addition of an innovative service to your price list, which attracts a new audience. High profitability for PlasmaLux due to the absence of consumables, for NeoPlasma due to premium positioning. Competitive advantage. Plasma technologies still remain niche offerings in the aesthetic cosmetology and medicine market. And the fact that the format of course procedures provides you with stable income and a long-term relationship with the patient. Now briefly about the two devices. You choose the PlasmaLux device if you are looking for an affordable solution to start, work with a result-oriented audience, want to avoid consumables, and are ready to work with rehabilitation. You choose the NeoPlasma device if you work in the premium segment, your clients value time, comfort, are ready to invest in top technologies, and want to offer procedures without rehabilitation. I want to show you some of my works, what I can do and what I will teach you. Very good results are achieved in facial rejuvenation, such as evening out skin tone and smoothing nasolabial folds. The upper eyelid is lifted, fine wrinkles are smoothed out, and puffiness under the eyes is reduced. In the fourth photo, we see how the double chin has decreased. Only 2 procedures were performed here. Working on the tummy gives excellent results. The next photo shows a reduction in pigmentation, overall rejuvenation. You can also work on wart removal. Here on the hand, we see a great result before and after just one procedure. Also working with nail fungus, scar polishing, removal by peels, and much more interesting things.